Hi, I'm Dr. John Nowicki, and I've been in private practice for the last 14 years. Well, it's estimated that about 85 to 95% of Americans actually have some type of adverse food reaction, but they don't even know it. It turns out that a lot of chronic conditions, migraine headaches, joint pain, irritable bowel syndrome, fatigue, sometimes even mood issues, irritability, anxiety, depression, all these things may actually be a result of what we're eating. However, we don't always associate what we're eating with how we're feeling sometimes. And there's lots of different reasons for that. Certainly with these types of food reactions, they can be very difficult to figure out, and for several different reasons. One, they don't always happen right after we eat the food. These types of reactions are chronic. Sometimes they're delayed. Sometimes they're cumulative, and you have to eat the same food over and over again before you actually experience these symptoms. So it can be very difficult to figure out on your own. The nice thing is that there's a simple blood test that's available that will determine which of these foods may be causing a problem and which ones aren't. The type of testing that we're looking at is the same type of test that we would do for Epstein-Barr virus or mono. If someone had mononucleosis, we do a certain type of testing called an ELISA test to see if their immune system is reacting to that virus. This type of test is doing the same thing, but rather than looking for an immune reaction against a virus, we're looking for an immune reaction against a food. If your immune system is attacking a food, it can be causing a problem. How that problem presents itself can vary from anything from fatigue to digestive issues to headaches to mood issues. So what we want to really look at is finding those foods that are causing that problem and then removing them from the diet. I've explored many labs throughout my 14 years of practice. Pathway has selected the premier lab to work with when looking for IgG food reactions. And I find that the lab that Pathway is using to be the best in the country. It's simple, it's easy, it's accurate, reliable, dependable, and actually quite effective. In my opinion, there just wouldn't be another lab that I would use other than the one that Pathway is using.